Good evening. I did my interview with Emily Durg, a Baptist downtown. She works in the main hospital in the behavioral health unit as an LMHC. First of all, she was a wonderful person to interview. She was very informative and personable. Uh, she she mentioned legislation. That was one of her big things throughout our interview was legislation and getting a firmer standing in legislation. And one thing that, resonated with me and I totally agree with is the fact that we need to unite as a profession to be recognized professionally. While that sounds confusing, it makes sense. We don't even have one set title for ourselves. We have LPCs in one area, LMHCs in another, and so on and so forth. But yet we want the outside world to respect us, but we don't even have one title to tell them. We want them to put funding into us, but we don't know who to tell them to fund. Well, you can fund the LMHC, but that doesn't fund the LPC, which makes sense. And I'm glad she brought that point up, and because it got me to thinking that as mental health counselors and being in this profession, we all have to be advocates for the field in order for it to, progress and unite as one. And she also mentioned patient first care, which is something that I'm totally for, because if you forget about the patients in the sense of your own profession or your career, you're losing on why we're supposed to be here. We're not here to, be fancy. Well, we're not supposed to be here to be fancy. We're here to help, you know, help people understand why they may be having these feelings and help them to, overall treat them versus treating their symptoms. And if you forget about the patient in all this, if you take it as a me experience versus a them experience, you're losing out on truly helping a patient. And patient first is something she was all about. She was like, that's the reason that we should come to work every day. Not, not to get the accolades and blah blah blah, but to, help a patient, help a person. She also mentioned how we have to, get your feet wet in the field first, which is something totally true for me because I have no professional background in it. I'm coming from a business related undergrad and going into this degree. I don't have any mental health counseling background. I don't have any social science background. So, one thing she mentioned just for all of us, to me, all future LMHCs, is to get your feet wet, volunteer with different organizations to see what you like before you graduate, get in the field, you think this is what you want to do, and it's really not what you want to do, which is, so true because it's in anything you would hate to, I'm gonna work with veterans and da 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 da, and then you actually work with veterans and you feel that's not what I want to do. But if you've already, dedicated your whole schooling career to this, it's sort of, I mean, it's not impossible, but it's, it's going to be difficult to, scale back and relearn something that you do like. Lastly, the one thing, if there's one thing I could take away from this interview that I appreciated from her was her openness and her willingness to, educate. And education is key in all this. You always have to be learning. You have to, learn yourself. You have to learn your clients. You have to always be learning in the mental health field, which is something she was big about. And I appreciate that because it makes you think. If you're not progressing yourself, how are you going to help a patient progress? If you're not acknowledging things within yourself that may be, transference or just, things to help you, think, if you're not acknowledging them, how can you help a patient or how can you expect the patient to open up to you? So the biggest thing that I took away from this interview was making sure you put the patient first and making sure you advocate for what you're doing. Don't just do it for, the recognition, but do it because this is something you want to do.